My name's Heidi Kile, and I'm a nurse practitioner with Bryan Heart. I was a nurse in a small hospital in central Nebraska and helped with cardiology clinic, actually. I had been contemplating going back to school to become a nurse practitioner, and I really felt that cardiology was something that really piqued my interest, and I didn't appreciate how much we can help people until I was involved in those cardiology clinics. As a nurse practitioner or advanced practice provider, we are able to evaluate and treat the patient in any fashion that we see reasonable and per guidelines. And that can include testing such as stress testing. We can order echocardiograms. We are able to titrate medications and prescribe different modalities. We do a lot of lab works for surveillance of medications and also for diagnosing conditions. And then we are obviously making sure that the cardiologists are aware of our plans for those patients. Every day is completely different from the previous day because you may have pretty stable patients that are just coming in for 6-month follow-ups. Other things that we see the patients for would be more of acute things. They maybe have had some palpitations or new atrial fibrillation. And the personal relationship, I like to get to know the patient from a non-medical perspective, find out what their hobbies are, and get those patients' needs addressed. I view patient-provider relationships as a two-way street. They need to know the information that they can make appropriate decisions about their care. We have to provide them with the insight and education upon their disease process, the medications that they may need to be taking, lifestyle changes. And I want to have them leave with the feeling that I would treat them just like I would treat my own family member. I feel pretty satisfied that we can have people that were having a lot of issues with symptoms or had to undergo a big procedure and then they've recovered from a big operation and they're finally getting back to normal, getting back to their life and feeling better than they did before they started their journey with us. And it just gives me a lot of satisfaction that they can have a higher quality of life because of the care that we provide.